Hi, I'm Steve Adubato. We are coming to you remotely, but again, the content is just as compelling. We are honored to kick off this program with Mr. Brian Gragnolati, President and CEO of Atlantic Health System. Brian, good to see you, my friend.
Great to see you.
You know, as it relates to COVID-19, we're taping on the 16th of June. It'll be seen after that. You said in an article, I believe in ROI, you said, quote, life as we know it is going to have to change.
Mhm.
In what ways?
I've labeled this internally and as coexisting with COVID. The reality is, until a vaccine is developed and until we have a silver bullet antiviral,
Right.
we are going to be living with COVID. And I expect that, quite frankly, to be at least a couple of years. So that means that we have to do things differently. And the example I like to use, which is a trite one, but I'm now liking the fact that I don't pump my own gas. I can take my wipe, hand it out on my credit card holding the wipe, get it back, and it's a different way of pumping gas. Think about that and extrapolate that to so many things you do, how you shop now, how you wear your mask, how, if you and I were in person, we probably wouldn't be shaking hands right now and we'd be 6 feet apart. That's the difference.
Let me just close a couple of things. First of all, Atlantic Health System, one of the healthcare systems underwriting our programming. Brian, but it's interesting. You said a couple of years, and Brian Strom from Rutgers University said something similar to that. And I challenged him. I didn't challenge him, but I followed up in this way. I'm going to do the same thing with you.
Sure.
If there's so much focus on a vaccine, potentially by the end of 2020, early 2021, and many people believe that's it, we're good. And then you just said a couple of years, they don't jibe.
Sure. So if you think about it pretty simply, the government has taken dramatic steps to try to close the gap on how long it takes to come up with a vaccine. And they've thrown a lot of resources at multiple people who are thinking about this, multiple companies who are thinking about this. And my bet is that we're not going to just have one vaccine. We will actually have multiple vaccines that are going to be available. But once those vaccines are developed and tested, you have to get them produced, you have to get them distributed, and you have to get people inoculated. And there's a supply chain element to this. There's a human nature element to this. And I do believe that we're going to be coexisting with COVID for 2 years.
Let me ask you this, because as I said, we're taping in the later part of June, be seen later. This second wave issue.
Mm-hmm.
If that plays out,
Mm-hmm.
first of all, we don't know how significant that wave would be. How are hospital systems like yours, others, we've interviewed your colleagues, your counterparts at different hospitals and hospital systems as well. How do you believe that the hospital systems or hospitals will be prepared differently and better?
Sure. Here in particularly northern New Jersey, we literally are a hotspot in the nation. We've taken care of over 10,000 patients with COVID, and we have had in our hospitals about 4,000 of those patients.
Brian, do me a favor, clarify the hospitals within the system.
So we have 7 different hospitals. We have hospitals in Morristown. We have hospitals at Overlook, Chilton, Newton, Hackettstown. We reopened a hospital to take care of patients, ARI, and we also have a rehab hospital.
Okay.
Because of our geography, and remember, this virus came out of the city. It followed the transit lines. We were in the middle of this for a long period of time, and we had to, in a very short period of time, double, triple, and then quadruple our intensive care unit capacity. And we had to, more importantly, reconfigure our teams in order to provide that, because we had to have the human resources to be able to do that. And we had incredible learning through that whole process. And because of that, we're going to be able to stand that capacity up again in short order, but it'll be done in an orderly fashion. So that's one piece. The second piece is we've learned a lot about how to take care of patients with this virus. And the way we provide care has changed over time. And because of that, again, I think we've got a better command on this. While our testing is still a problem, we have gotten our arms around getting quicker testing, and that's going to help. But the key thing that we're still worried about right now is making sure that we're going to have an adequate amount of protective equipment for our team members, and we're working hard to make sure that that happens. But I would like to be in a position this fall where we have the ability to surge to 125% of what our peak was. But I get down on my knees every night and pray that that doesn't happen.
Brian, the other side of this, for your colleagues, frontline workers, describe for folks what they have faced and will continue to face.
So our team members on the front line are indeed our heroes. I had an opportunity to round just at the end of last week at Morristown Medical Center, which had just a number of COVID patients that were cared for. And I saw a clap out of a patient who had been with us 61 days. 61 days he had been with us. And our team members were in tears, and it was just such a joyous occasion. But make no mistake, they are our heroes, and it has been very, very hard work. And it's been hard for a couple of reasons. We're used to taking care of really sick patients, but this disease was not able to be compartmentalized.
What do you mean by that?
In other words, I was an EMT, and if you had a very difficult case, you knew that you did your very best and things would go on. You can't get away from COVID. You're worried about taking it home. You're worried about going to the grocery store. It's on television all the time. You can't compartmentalize it. The second thing is, in order to be effective, you have to isolate and socially distance in ways that in healthcare, we're just not used to. Because, part of, again, if you're a clinician, you have the ability to hug, or you have the ability to high five, and you have the ability to cry together or laugh together. You're in a mask, you're in a face shield, you're gloved up. It's very different. And probably the most difficult thing was the inability for patients to see their loved ones directly during this process because of the limits we had to put on visitors. And oftentimes our team members were holding the patient's hand and holding a cell phone during those difficult conversations, particularly those patients that had to be intubated and those patients that were passed away. And it put our team members in an unbelievable position. And I am so proud of what they've done.
We've got a minute left. As you listen to Brian Gragnolati, I'm just trying to imagine the reality of what he's talking about, and I actually can't. But I digress. I want to follow up on this the minute we have left. The question of telehealth, more important than ever before, correct?
Absolutely.
And the future of it is?
The future of it is depending on how the government responds and how payers respond. We have transformed care as it relates to telehealth and put it in a more consumer-friendly manner and put it in people's homes where they're safe. We went from doing about 10 telehealth visits a day. Within 2 weeks in our practices, it went to 3,000 telehealth visits a day. Now, the government has enabled that because they've allowed us to be paid for that. We need to make sure that those rules that were put in place during this emergency are codified and put into law. And we've got to make sure that the payers, the insurance companies, continue to adopt paying for those practices. And that's critically important because it is here to stay. But if it doesn't get paid for, it's not going to work.
Brian Gragnolati is President and CEO of Atlantic Health System. Brian, I want to thank you so much for joining us. I wish you and your team all the best.
Thank you.
We'll be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Fidelco Group, Horizon Blue Cross Blue Shield of New Jersey, Investors Bank, Gibbons PC, PSC&G, the Port Authority of New York and New Jersey, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, and by the Adler Aphasia Center. Promotional support provided by the New Jersey Business and Industry Association and by AM 970 The Answer.